Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuy.com. This is 30 Practice NCLEX questions. Without delay, let's get started.
A multigravida client is admitted at 4 centimeters dilation and requesting pain medication. The nurse gives the client nalbuphine 15 milligrams. Within 5 minutes, the client tells the nurse she feels like she needs to have a bowel movement. The nurse should first, 1. Have naloxone hydrochloride available in the birthing room. 2. Complete a vaginal examination to determine dilation, effacement, and station. 3. Prepare for birth. 4. Document the client's relief due to pain medication. The correct answer is 2. The feeling of needing to have a bowel movement is commonly caused by pressure on the receptors low in the perineum when the fetal head is creating pressure on them. This feeling usually indicates advances in fetal station and that the client may be close to birth. The nurse should respond initially to the client's signs and symptoms by checking to validate current effacement, dilation, and station. If the fetus is ready to be born, having the room ready for the birth and having naloxone hydrochloride available are important. Narcan completely or partially reverses the effects of natural and synthetic opioids, including respiratory depression. Documenting pain relief takes time away from a vaginal examination, preparing for birth, and obtaining Narcan. The birth may be occurring rapidly. Being prepared for the birth is a higher priority than documentation for this client. Which of the following would be an important assessment finding for an 8-month-old infant admitted with severe diarrhea? 1. Bowel sounds every 5 seconds. 2. Pale yellow urine. 3. Normal skin elasticity. 4. Depressed anterior fontanelle. The correct answer is 4. An infant with severe diarrhea will experience some degree of dehydration. In an 8-month-old child, the anterior fontanelle has not closed. Therefore, a depressed anterior fontanelle would be an important finding. Additionally, the infant would exhibit dry mucous membranes, lethargy, hyperactive bowel sounds, dark urine, and sunken eyeballs. Skin turgor will be decreased or delayed. Bowel sounds every 5 seconds would not be considered abnormal for an infant. An infant is to be discharged after surgery for intussusception. In developing the discharge teaching plan, the nurse should tell the mother, 1. The infant will experience a change in the normal home routine. 2. The infant can return to the pre-hospital routine immediately. 3. The infant needs to ingest more calories at home than what was consumed in the hospital. 4. The infant will continue to experience abdominal cramping for a few days. The correct answer is 1. Infants who have had an interruption in their normal routine and experiences, such as hospitalization and surgery, typically manifest behavior changes when discharged. The infant's normal routine has been significantly altered, so it will take time to reestablish another routine. Calorie requirements at home will continue to be the same as those in the hospital. The infant does not need more calories at home. The surgical procedure corrected the problems, so the infant should not continue to have abdominal cramping. A client is taking an antacid for treatment of a peptic ulcer. Which of the following statements best indicates that the client understands how to correctly take the antacid? 1. I should take my antacid before I take my other medications. 2. I need to decrease my intake of fluids so that I don't dilute the effects of my antacid. 3. My antacid will be most effective if I take it whenever I experience stomach pains. 4. It is best for me to take my antacid 1 to 3 hours after meals. The correct answer is 4. Antacids are most effective if taken 1 to 3 hours after meals and at bedtime, when an antacid is taken on an empty stomach. The duration of the drug's action is greatly decreased. Taking antacids 1 to 3 hours after a meal lengthens the duration of action, thus increasing the therapeutic action of the drug. Antacids should be administered about 2 hours after other medications to decrease the chance of drug interactions. It is not necessary to decrease fluid intake when taking antacids. If antacids are taken more frequently than recommended, the likelihood of developing adverse effects increases. Therefore, the client should not take antacids as often as desired to control pain. The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun and syphilis, use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The family of a client diagnosed with Alzheimer's disease wants to keep the client at home. They say that they have the most difficulty in managing his wandering. The nurse should instruct the family to do which of the following? Select all that apply. 1. Ask the primary healthcare provider for a sleeping medication. 2. Install motion and sound detectors. 3. Have a relative sit with the client all night. 4. Have the client wear a medical alert bracelet. 5. Install door alarms and high door locks. The correct answers are 2, 4, and 5. Motion and sound detectors, a medical alert bracelet, and door alarms are all appropriate interventions for wandering. Sleep medications do not prevent wandering before and after the client is asleep and may have negative effects. Having a relative sit with the client is usually an unrealistic burden. A charge nurse and an LPN are working in the labor and birth unit. Of the following assessments and interventions that must be done immediately, which should the charge nurse assign to the LPN? 1. Complete an initial assessment on a client. 2. Increase the oxytocin rate on a laboring client. 3. Perform a straight catheterization for protein analysis. 4. Recover a mother following cesarean birth. The correct answer is 3. The straight catheterization is within the scope of practice of a licensed practical nurse. An initial or continuing assessment is the responsibility of the registered nurse. Assessment must be complete before increasing the IV rate of oxytocin. The assessment and the increase in oxytocin rate are responsibilities for the registered nurse. The RN, not the LPN, recovers clients who have had surgery because frequent assessments are needed. 2 hours ago, a multigravida client was admitted in active labor with her cervix dilated at 5 centimeters and completely effaced and the fetus at 0 station. Currently, the client is experiencing nausea and vomiting, a slight chill with perspiration beads on her lip, and extreme irritability. The nurse should first 1. Warm the temperature of the room by a few degrees. 2. Increase the rate of intravenous fluid administration. 3. Obtain a prescription for an intramuscular antiemetic medication. 4. Assess the client's cervical dilation and station. The correct answer is 4. The nurse should assess the client's cervical dilation and station because the client's symptoms are indicative of the transition phase of labor. Multiparous clients can proceed 5 to 9 centimeters per hour during the active phase of labor. Warming the temperature of the room is not helpful because the client will soon be ready to begin expulsive pushing. Increasing the intravenous fluid rate is not warranted unless the client is experiencing dehydration. Administration of an antiemetic at this point in labor is not warranted and may result in neonatal depression should a rapid birth occur. The primary care provider prescribes intravenous fluid replacement therapy with potassium chloride to be added for a child with severe gastroenteritis. Before adding the potassium chloride to the intravenous fluid, which of the following assessments will be most important? 1. Ability to void. 2. Passage of stool today. 3. Baseline electrocardiogram. 4. Serum calcium level. The correct answer is 1. Potassium chloride is readily excreted in the urine. Before adding potassium chloride to the IV fluid, the nurse should ascertain whether the child can void. If not, potassium chloride may build up in the serum and cause hyperkalemia. An electrocardiogram could be done during intravenous potassium replacement therapy to evaluate for these changes. Having a stool daily is important, but because potassium is primarily excreted in the urine, the child's ability to void must be verified. Serum calcium levels do not indicate the child's ability to tolerate potassium replacement. After teaching the parents of an infant diagnosed with Hirschsprung's disease, the nurse determines that the parents understand the diagnosis when the father states which of the following? 1. There is no rectal opening for stool to pass. 2. There's a tube between the trachea and esophagus. 3. The nerves at the end of the large colon are missing. 4. The muscle below the stomach is too tight. The correct answer is 3. The primary defect in Hirschsprung's disease is an absence of autonomic parasympathetic ganglion cells in the distal portion of the colon. Thus, the nerves at the end of the large colon are missing. Absence of a rectal opening refers to an imperforate anus. A tube between the trachea and esophagus refers to a tracheoesophageal fistula. Presence of a tight muscle below the stomach refers to pyloric stenosis. Following a gastrectomy, the nurse should position the client in which of the following positions? 1. Prone. 2. Supine. 3. Low Fowlers. 4. Right or left Sims. The correct answer is 3. A client who has had abdominal surgery is best placed in a low Fowler's position postoperatively. This positioning relaxes abdominal muscles and provides for maximum respiratory and cardiovascular function. The prone, supine, or Sims position would not be tolerated by a client who has had abdominal surgery, nor do those positions support respiratory or cardiovascular functioning. When obtaining a nursing history from a client with a suspected gastric ulcer, which signs and symptoms should the nurse assess? Select all that apply. 1. Epigastric pain at night. 2. Relief of epigastric pain after eating. 3. Vomiting. 4. Weight loss. 5. Melena. The correct answers are 3, 4, and 5. Vomiting and weight loss are common with gastric ulcers. The client may also have blood in the stools from gastric bleeding. Clients with a gastric ulcer are most likely to have a burning epigastric pain that occurs about 1 hour after eating. Eating frequently aggravates the pain. Clients with duodenal ulcers are more likely to have pain that occurs during the night and is frequently relieved by eating. A client reports having blurred vision after 4 days of taking haloperidol 1 milligram twice a day and benztropine 2 milligrams twice a day. The nurse contacts the primary healthcare provider to explain the situation, background, and assessment and make a recommendation. Which information reported to the primary healthcare provider is the assessment of the situation. 1. Mr. Roberts is taking 1 milligram of Haldol twice a day and Cogentin 2 milligrams twice a day. 2. I think Mr. Roberts might need a lower dose of Cogentin. 3. Mr. Roberts reports having blurred vision since this morning. 4. The higher dose of Cogentin could be causing Mr. Roberts' blurred vision. The correct answer is 4. Cogentin has a common side effect of blurred vision. After evaluating the relative doses of Haldol and Cogentin, the assessment would be that the higher dose of Cogentin compared to the dose of Haldol is responsible for the blurred vision. High doses of Haldol can cause blurred vision at times. Reporting that Mr. Roberts has blurred vision is the situation. Listing the medications and doses is describing the background. The recommendation would be a lower dose of Cogentin. A client is experiencing agnosia as a result of vascular dementia. She is staring at dinner and utensils without trying to eat. Which intervention should the nurse attempt first? 1. Pick up the fork and feed the client slowly. 2. Say, it's time for you to start eating your dinner. 3. Hand the fork to client and say, use this fork to eat your green beans. 4. Save the client's dinner until her family comes in to feed her. The correct answer is 3. Agnosia is the lack of recognition of objects and their purpose. The nurse should inform the client about the fork and what to do with it. Feeding the client does not address the agnosia or give the client specific directions. It should only be attempted if identifying the fork and explaining what to do with it is ineffective. Waiting for the family to care for the client is not appropriate unless identifying the fork and explaining or feeding the client is not successful. A client at 33 weeks gestation is admitted in preterm labor. She is given betamethasone 12 milligrams IM every 24 hours times 2. What is the expected outcome of this drug therapy? 1. The contractions will end within 24 hours. 2. The client will give birth to a neonate without infection. 3. The client will give birth to a full-term neonate. 4. The neonate will be born with mature lungs. The correct answer is 4. Betamethasone is a corticosteroid that induces the production of surfactant. The pulmonary maturation that results causes the fetal lungs to mature more rapidly than normal. Because the lungs are mature, the risk of respiratory distress in the neonate is lowered but not eliminated. Betamethasone also decreases the surface tension within the alveoli. Betamethasone has no influence on contractions or carrying the fetus to full term. It also does not prevent infection. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse is preparing a change of shift report and has been caring for a multigravida client with a normally progressing labor. Which of the following information should be part of this report? Select all that apply. 1. Interpretation of the fetal monitor strip. 2. Analgesia or anesthesia being used. 3. Anticipated method of birth control. 4. Amount of vaginal bleeding or discharge. 5. Support persons with the client. 6. Prior birth history. The correct answers are 1, 2, 4, 5, and 6. Knowledge of how the fetus is tolerating contractions, as well as the frequency, intensity, and duration of contractions, as indicated on the fetal monitor strip, are extremely important. The type of analgesia or anesthesia being used, the client's response, and her pain rating should be included as well. The amount of vaginal bleeding indicates whether this labor is in the normal range. Vaginal discharge indicates if membranes are ruptured in the color, odor, and amount of amniotic fluid. The support persons with the client are an integral part of the labor process and greatly influence how she manages labor emotionally and, commonly, physically. A complete change of shift report would include the client's name, age, gravida, and parity, current and prior illnesses that may influence this hospitalization, prior labor and birth history if applicable, last vaginal examination time and findings, vaginal bleeding, support persons with client, current IVs and other medications being used, and pertinent laboratory test results. Future plan for birth control would be the least important information to be given to the next shift because it will not impact the labor care plan. Which of the following will most likely alert the nurse to the possibility that a preschooler is experiencing moderate dehydration? 1. Deep, rapid respirations. 2. Diaphoresis. 3. Absence of tear formation. 4. Decreased urine-specific gravity. The correct answer is 3. The absence of tears is typically found when moderate dehydration is observed as the body attempts to conserve fluids. Other typical findings associated with moderate dehydration include a dry mouth, sunken eyes, poor skin turgor, and an increased pulse rate. Deep, rapid respirations are associated with severe dehydration. Decreased perspiration, not diaphoresis, would be seen with moderate dehydration. The specific gravity of urine increases with decreased output in the presence of dehydration. Which of the following assessments should be the priority for an infant who has had surgery to correct an intussusception and is now at risk for development of a paralytic ileus postoperatively? 1. Measurement of urine-specific gravity. 2. Auscultation of bowel sounds. 3. Inspection of the first stool passed. 4. Measurement of gastric output. The correct answer is 2. Development of a paralytic ileus postoperatively is a functional obstruction of the bowel. Bowel sounds initially may be hyperactive, but then they diminish and cease. Measurement of urine specific gravity provides information about fluid and electrolyte status. The first stool and the amount of gastric output provide information about the return of gastric function. A client has been taking aluminum hydroxide 30 milliliters 6 times per day at home to treat a peptic ulcer. The client has been unable to have a bowel movement for 3 days. Based on this information, the nurse would determine that which of the following is the most likely cause of the client's constipation. 1. The client has not been including enough fiber in the diet. 2. The client needs to increase the daily exercise. 3. The client is experiencing an adverse effect of the aluminum hydroxide. 4. The client has developed a gastrointestinal obstruction. The correct answer is 3. It is most likely that the client is experiencing an adverse effect of the antacid. Antacids, aluminum salt products, such as aluminum hydroxide, form insoluble salts in the body. These precipitate and accumulate in the intestines, causing constipation. Increasing dietary fiber intake or daily exercise may be a beneficial lifestyle change for the client, but is not likely to relieve the constipation caused by the aluminum hydroxide. Constipation, in isolation from other symptoms, is not a sign of a bowel obstruction. During the assessment of a client's mouth, the nurse notes the absence of saliva. The client reports having pain behind the ear. The client has been nothing by mouth for several days, but now can have liquids. Based on these findings, the nurse should do which of the following? 1. Request a prescription for an antifungal mouthwash. 2. Instruct the client to brush the gums as well as the teeth. 3. Encourage the client to suck on hard candy. 4. Give the client a hydrogen peroxide-based mouthwash. The correct answer is 3. The lack of saliva, pain near the area of the ear, and the prolonged NPO status of the client are indications that the client may be developing parotitis or inflammation of the parotid gland. Parotitis usually develops with dehydration combined with poor oral hygiene, or when clients have been NPO for an extended period. Preventive measures include the use of sugarless hard candy or gum to stimulate saliva production, adequate hydration, and frequent mouth care. The client does not have indications of stomatitis, which produces excessive salivation and a sore mouth. The client does not have indications of oral candidiasis, which causes bluish-white mouth lesions, and a nurse does not need to request a prescription for an antifungal mouthwash. There are no indications that the client has gingivitis, which can be recognized by the inflamed gingiva and bleeding that occur during toothbrushing, and while the client should brush the teeth and gums, increasing salivation to prevent parotitis is a priority at this time. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When developing a plan of care for a client with Alzheimer's disease who is experiencing moderate impairment, which of the following types of care should the nurse expect to include? 1. Prompting and guiding activities of daily living. 2. Managing a medication schedule. 3. Constant supervision and total care. 4. Supervision of risky activities, such as shaving. The correct answer is 1. Considerable assistance is associated with moderate impairment when the client cannot make decisions but can follow directions. Managing medications is needed even in mild impairment. Constant care is needed in the terminal phase when the client cannot follow directions. Supervision of shaving is appropriate with mild impairment. That is, when the client still has motor function but lacks judgment about safety issues. As a nurse begins her shift on the obstetrical unit, there are several new admissions. The client with which of the following conditions would be a candidate for induction? 1. Preeclampsia. 2. Active herpes. 3. Face presentation. 4. Fetus with late decelerations. The correct answer is 1. The client with preeclampsia would be a candidate for the induction process because ending the pregnancy is the only way to cure preeclampsia. A client with active herpes would be a candidate for a cesarean section to prevent the fetus from contracting the virus while passing to the birth canal. The woman with a face presentation will not be able to give birth vaginally due to the extended position of the neck. The client whose fetus exhibits late decelerations without oxytocin would be at greater risk for fetal distress with use of this drug. Late decelerations indicate the fetus does not have enough placental reserves to remain oxygenated during the entire contraction. This client may require a cesarean section. Which of the following would the nurse expect as a common finding for a multiparous client giving birth to a viable neonate at 41 weeks gestation with the aid of a vacuum extractor? 1. Caput succedaneum. 2. Cephalohematoma. 3. Maternal lacerations. 4. Neonatal intracranial hemorrhage. The correct answer is 1. Caput succedaneum is common after the use of a vacuum extractor to assist the client's expulsion efforts. This edema may persist up to 7 days. Vacuum extraction is not associated with cephalohematoma. Maternal lacerations may occur, but they are more common when forceps are used. Neonatal intracranial hemorrhage is a risk with both vacuum extraction and forceps births, but it is not a common finding. A 9-month-old is admitted because of dehydration. How should the nurse go about accurately monitoring fluid intake and output? Select all that apply. 1. Weighing and recording all wet diapers. 2. Change breastfeedings to bottle feedings. 3. Obtaining an accurate daily weight. 4. Restricting fluids prior to weighing the child. 5. Obtaining an accurate stool count. The correct answers are 1, 3, and 5. Accurate intake and output recording includes noting all intake, including IV fluids, noting output, such as emesis and stool, weighing diapers, measuring weight daily, measuring urine-specific gravity, monitoring serum electrolytes, and monitoring for signs of dehydration. Children who are dehydrated must receive sufficient fluid intake, but having a breastfeeding child switch to bottle feeding will not promote intake. Restricting fluids just prior to weighing the child will not alter the accuracy of the weight, and the nurse should continue to encourage fluids for this dehydrated child. An infant diagnosed with Hirschsprung's disease is scheduled to receive a temporary colostomy. When initially discussing the diagnosis and treatment with the parents, which of the following would be most appropriate? 1. Assessing the adequacy of their coping skills. 2. Reassuring them that their child will be fine. 3. Encouraging them to ask questions. 4. Giving them printed material on the procedure. The correct answer is 3. By encouraging parents to ask questions during information sharing sessions, the nurse can clarify misconceptions and determine the parent's understanding of information. A better understanding of what is happening allows the parents to feel some control over the situation. Assessing the adequacy of the parents' coping skills is important, but secondary to encouraging them to express their concerns. The questions they ask and their interactions with a nurse may provide clues to the adequacy of their coping skills. The nurse should never give false reassurance to parents. At this point, there is no way for the nurse to know whether the child will be fine. Written materials are appropriate for augmenting the nurse's verbal communication. However, these are secondary to encouraging questions. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client who is recovering from gastric surgery is receiving IV fluids to be infused at 100 milliliters per hour. The IV tubing delivers 15 drops per milliliter. The nurse should infuse the solution at a flow rate of how many drops per minute to ensure that the client receives 100 milliliters per hour? Blank drops per minute. The correct answer is 25 drops per minute. To administer IV fluids at 100 milliliters per hour using tubing that has a drip factor of 15 drops per milliliter, the nurse should use the following formula: 100 milliliters over 60 minutes multiplied by 15 drops over 1 milliliter, which equals to 25 drops per minute. A client is admitted to the hospital after vomiting bright red blood and is diagnosed with a bleeding duodenal ulcer. The client develops a sudden, sharp pain in the mid-epigastric region, along with a rigid, board-like abdomen. The nurse should do which of the following first? 1. Administer pain medication as prescribed. 2. Raise the head of the bed. 3. Prepare to insert a nasogastric tube. 4. Notify the physician. The correct answer is 4. The client is experiencing a perforation of the ulcer, and the nurse should notify the physician immediately. The body reacts to perforation of an ulcer by immobilizing the area as much as possible. This results in board-like abdominal rigidity, usually with extreme pain. Perforation is a medical emergency requiring immediate surgical intervention because peritonitis develops quickly after perforation. Administering pain medication is not the first action, although the nurse later should institute measures to relieve pain. Elevating the head of the bed will not minimize the perforation. A nasogastric tube may be used following surgery. An elderly client who has been diagnosed with delusional disorder for many years is exhibiting early symptoms of dementia. His daughter lives with him to help him manage daily activities, and he attends a daycare program for seniors during the week while she works. A nurse at the daycare center hears him say, "If my neighbor puts up a fence, I'll blow him away. He has never respected my property line, and I've had it." Which of the following actions should the nurse take? 1. Observe the client more closely, but do not report his threat, since he will likely not be able to follow through with it because of his dementia. 2. Report the comment to the client's daughter, so she can observe him more closely, but refrain from telling the neighbor due to privacy regulations. 3. Report the comment to the neighbor, the intended victim, but refrain from telling the daughter since she will just worry about actions of her father she cannot control. 4. Report the comment to the neighbor, the daughter, and the police since there is a potential for a criminal act. The correct answer is 4. The neighbor could be harmed as well as the daughter if she should try to stop her father, so both should be notified. The nurse has a legal/ethical responsibility to warn potential victims and other involved parties, as well as law enforcement authorities, when one person makes a threat against another person. This duty supersedes confidentiality statutes. Failure to do so and to document it can result in civil penalties. The client's early dementia would likely not prevent him from carrying through his threat. During a home visit to an elderly client with mild dementia, the client's daughter reports that she has one major problem with her mother. She says, "She sleeps most of the day and is up most of the night. I can't get a decent night's sleep anymore." Which suggestions should the nurse make to the daughter? Select all that apply. 1. Ask the client's primary healthcare provider for a strong sleep medicine. 2. Establish a set routine for rising, hygiene, meals, short rest periods, and bedtime. 3. Engage the client in simple, brief exercises or a short walk when she gets drowsy during the day. 4. Promote relaxation before bedtime with a warm bath or relaxing music. 5. Have the daughter encourage the use of caffeinated beverages during the day to keep her mother awake. The correct answers are 2, 3, and 4. A set routine and brief exercises help decrease daytime sleeping. Decreasing caffeine in fluids and promoting relaxation at bedtime promote nighttime sleeping. A strong sleep medicine for an elderly client is contraindicated due to changes in metabolism, increased adverse effects, and the risk of falls. Using caffeinated beverages may stimulate metabolism, but can also have long-lasting adverse effects and may prevent sleep at bedtime. A client is admitted at 30 weeks gestation with contractions every 3 minutes. Her cervix is 1 to 2 centimeters dilated and 75% effaced. Following a 4 grams bolus dose, IV magnesium sulfate is infusing at 2 grams per hour. How will the nurse know the medication is having the intended effect? 1. Contractions will increase in frequency, leading to birth. 2. The client will maintain a respiratory rate greater than 12 breaths per minute. 3. Contractions will decrease in frequency, intensity, and duration. 4. The client will maintain blood pressure readings of 120/80. The correct answer is 3. The expected outcome of magnesium sulfate administration is suppression of the contractions because the client is in preterm labor. Magnesium sulfate is a smooth muscle relaxant used to slow and stop contractions. Having contractions that lead to birth is not the intended effect of this drug when used for preterm labor. Respirations lower than 12 breaths per minute may indicate magnesium sulfate toxicity. Another use of magnesium sulfate is to treat preeclampsia by preventing seizures and, secondarily, lowering maternal blood pressure. However, in this scenario, preterm labor, not preeclampsia, is being treated. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.